So we will now have Conor Ruzycki, which will be presenting the airborne natures and more details on that. So go ahead, Conor.
Just, you can see. Sure. All right. Okay. Back here. All right. There we go. So before we dig into airborne transmission specifically, I just want to review a few of the things that we've observed with COVID-19. So of particular importance are the super spreading events that we've seen very regularly covered in the news. These super spreading events where basically you have one person who is infecting several others, who then they may themselves go on to transmit to even more people down the line. They aren't really linked to any particular activity or event. We've seen these outbreaks occur in a huge range of different events and activities, everything from cruise ships to church choirs, weddings, meatpacking facilities, nightclubs. And if we dig into these different sorts of super spreading events, we start to notice that there are a few common features among all of them. And one of the most important common features is that these are always essentially occurring indoors. Other factors that are playing a role here with these super spreading events are things like limited ventilation, inconsistent mask use, and long durations of exposure. Something else that we've noticed with COVID-19 is that it's a very overdispersed disease. And that means that relatively few people are responsible for the majority of transmission occurring. We're talking something like 10 to 20% of people being responsible for maybe about 80% of transmissions. And that tells us that it's very, very important to control for and to avoid these super spreading events as much as possible. If we get rid of these super spreading events, we can really cut down on the chains of transmission that make this disease so hard to manage. And another thing that we've noticed with COVID-19 is that asymptomatic and pre-symptomatic transmission is considerable. And there are estimates that up to about 50% of total transmissions might be occurring from people who, they're not demonstrating symptoms of illness. And considering that pre-symptomatic and asymptomatic people, they really aren't coughing or sneezing, we have to sort of wonder how they can be spreading this disease to others. So that brings us to bioaerosols. And what are bioaerosols? Well, they're basically just tiny particles that are created in our airways, and they're made up of things like water, salts, proteins, and other material that can be found in the fluid that lines our airways and in saliva. And if somebody happens to be infected with COVID-19, these bioaerosols that we're producing can actually contain individual SARS-CoV-2 viruses. And it turns out that we're actually constantly creating these bioaerosols during any number of actions. So we tend to emit relatively few when we're just breathing, but we produce far, far more when we talk, when we exercise, cough, sneeze, do all those sorts of things. And some really good studies have actually demonstrated this recently, like this one here, which is essentially showing that, in this context, patients are actually producing huge amounts of aerosol during those sorts of things like, exercising, shouting, coughing. And more aerosol then has actually been noted during certain medical procedures that have been associated with an increased risk because they were thought to create aerosols. So one thing to note is that because aerosols are so tiny, we actually need fairly sophisticated equipment to be able to measure them accurately. And that's something that we haven't really had access to in the past. But we've been developing these instrumentation methods and methodologies more and more in the past few decades, and that's sort of allowing us to figure out that these bioaerosols are actually being produced all the time. One thing is that bioaerosol by itself is not necessarily dangerous. We need to figure out if we actually need to worry about them. And let's briefly talk about how these aerosols behave. Basically, physics tells us that we know that aerosols are going to spread out from the source. They're most concentrated at the spot of emission, so basically at your mouth if you're infected with COVID-19 and you're releasing these particles, and they spread out with distance. So because of how they behave, we need to keep in mind that you can inhale these things both when you're close to a person that's emitting these particles and when you're far away. You can see the motion of these sorts of particles if you look at a time series of images that's actually occurring for a sneeze. You start off near the mouth, and it's going to spread out over time and sort of go out throughout the entire room. And just like cigarette smoke, bioaerosol can build up in occupied spaces over time. And the concentration of these bioaerosols, if you have a poorly ventilated space, is going to increase over time. And it'll increase, the longer that people spend in that room. Something else that the science tells us is that we always have some convective and buoyant motion that's occurring with, breathing, talking, and coughing. And this means that bioaerosol is basically always going to tend to spread out in a room with or without the presence of ambient air currents. So as a result, the idea of there being like a safe distance between people when you're indoors, it really loses meaning. The whole 2-meter rule doesn't really apply when you're talking about inhalation exposure indoors. So probably the most important question that we need to answer is whether bioaerosol that contains SARS-CoV-2 virus, whether that bioaerosol is actually infectious. And we've had several studies that have found viral RNA in air samples, but this is not actually totally indicative of infectivity, because viral RNA by itself can actually come from dead or inactivated virus. But it turns out that culturing live virus from any disease is notoriously difficult from air samples. It's so difficult that it hasn't actually been done with measles and with the measles virus, and measles is pretty much the gold standard of what's considered an airborne disease. But the rather amazing thing that has been done with SARS-CoV-2 now is that there's been at least one study that has actually successfully cultured live virus from an air sample. And this was done by a group that was looking at air samples inside of a room with COVID-19 patients. This is a very, very strong finding, and it actually lends a lot of support to the idea that bioaerosols can act as a vector of transmission. So, and if we couple that fact that we've had live virus, we're seeing these arguments from the basic sciences. You've got super spreading events, pre-symptomatic transmission, and what we've observed is the vastly increased risk of transmission occurring indoors. All of this is sort of pointing towards the answer that yes, bioaerosols are playing a very important role in the transmission of COVID-19, of SARS-CoV-2 rather. So knowing that bioaerosols are important, what are some of the things we can start to do to address them? Well, for one, masks are actually extremely useful here, and they do two things. One thing is that they help to reduce the amount and the spread of aerosols from the source. So they reduce that from an infected person, but they also provide some protection to the other people in the area who might be exposed to that infected person. And there are three very important factors that tell us how to optimize protection we get from masks. These are filtration, breathability, and fit. And to maximize the amount of protection we get from masks, we need to use materials that have a high filtration efficiency of aerosol particles, but that also give us a fit that makes sure that we're breathing through the mask and not around the mask. And there's been a lot of great infographics that have come out on this. One example is sort of down here on the right that is summarizing a lot of this information. In the past few months, we've had a lot of Canadian suppliers who have stepped up to begin manufacturing and distributing better masks and respirators. And if you're actually interested in trying to find one for yourself, there's a good list that's been compiled by one of these advocacy groups, which is Masks for Canada. Now, I'll just note that respirators are actually fantastic tools to reduce your exposure to bioaerosols, and we really aren't using them nearly as widely as we should be. Given that we don't really have the same supply issues we had early in the pandemic, I think we should be doing everything we can to be getting respirators to essential workers, the people who are facing the highest risk of exposure in their day-to-day activities. And what about mitigating inhalation exposure in general? This is a really good infographic that provides a quick summary of what are considered to be safe activities or good measures to implement, in green, and what are some of the things that we need to avoid as much as possible in red. And at this point, we actually need to be avoiding indoor gatherings as much as possible. But if we do have to go indoors, and sometimes we do, there are a number of things you can do to help reduce your risk of exposure. These are things like well-fitting masks, making sure you're maintaining physical distance, avoiding crowds as much as possible, reducing the time you spend there. These are all really good things you can do to help reduce your risk of exposure due to inhalation. And another really useful tool that you may or may not be aware of is actually, implementing carbon dioxide measuring, because the amount of carbon dioxide in a room can give you a good idea of roughly how good the ventilation is in that space. The lower your level of carbon dioxide, the better. And once you get below about something like 450 parts per million, you're basically at outdoor levels, which is indicating that you have fantastic ventilation and you're really avoiding any potential buildup of bioaerosol over time if you're sharing that space with somebody who may be infected. So it is important to be able to have outlets and activities to do. If you can get outdoors, if you can maintain physical distance, and avoid crowds, you can generally consider that a pretty safe activity, and it's a good way to avoid being stuck indoors at all times. So generally, this is good to do, avoid the indoor stuff as much as possible. And the last slide here, I'll just reiterate some of the various ways that we can mitigate transmission indoors. Lots of different things we can do. Regular and consistent masking, upgrading to better masks and respirators. Improving ventilation. Ideally, you're aiming for very high air exchange rates. Incorporating HEPA-type air purifiers, opening doors and windows, reducing exposure times, consistent physical distancing. Obviously, good hand hygiene plays a role too. And considering using things like monitoring CO2 to inform how good the ventilation is in these different areas that we're gathering. What do we want to avoid? Well, we need to avoid any non-essential indoor gathering. Indoor dining is a good example of something that we should not be doing at the moment. And we should be moving events and gatherings outdoors as much as possible. But if there are scenarios where indoor gatherings are necessary, we need to consider implementing many or as many of these layers as possible, really, to mitigate transmission risks as much as possible. And a good way to think about this is sort of the Swiss cheese model of risk mitigation, where the more mitigating measures you put in place, it really reduces the chances that if one layer fails, it doesn't necessarily result in a transmission. So if you add in these multiple layers of protection, you can make it so that the failure of one layer, does not result in an outbreak occurring. And I think given what we're seeing with the increased transmissibility of the variants of concern that Gojia was talking about, we seriously need to consider pushing to incorporate as many of these layers as possible to prevent transmission moving forward. And tying this in with zero COVID is that zero COVID is a much safer and more sustainable strategy to control transmission than it is to implement all these factors, especially because we haven't really done this up to this point. And without all of these sorts of measures in place, we really have no hope of preventing these sort of outbreaks from occurring, if we have significant community transmission already.